When reflecting back on my family, I don't have much that I'm able to report on due to my family situation being a little bit odd. But something that I am able to reflect on that connects to both the video that we watched, or one of the TED Talks that we watched, as well as the kind of nature and nurture section of this week's course. My mother, I do remember her saying when I was younger that she was constantly craving peanut butter and jelly and lemonade. So she ate those very regularly. And for as long as I can remember, I have never liked peanut butter. So that is kind of an interesting one that I can look at. My mother was also highly stressed during her pregnancy and was likely around a lot of secondhand smoke just because all of her friends, as well as my dad, smoked when I was in gestation. So throughout the course of my life, I was diagnosed with ADHD at age 20, but I have also always been really anxious. However, the nature and nurture part comes into play because my mother also has ADHD, but I also underwent a lot of trauma, so it just kind of leads me to reflect how much of that was from genes, but also how much of it was from the environment that I developed in after birth. So a practice/tradition that I decided to look into to kind of expand upon everything was I remember seeing something a while ago talking about gravity-assisted birthing techniques. So I decided to do a little bit more research on that since that wasn't mentioned as much through the alternative birthing methods section of this week's coursework. So the standard birthing method in the US is usually a woman laying on her back. A gravity-assisted birth is using multiple methods. It could either be being on all fours or squatting or using what's called a birthing chair. So a study that I found from the Library of Medicine conducted a controlled study of a comparison between laying on one's back as a control group and then a group of women who used a birthing chair. The results found that it was a quicker and easier birth for women to use the chair. It resulted in less blood loss during the third stage of pregnancy, less oxytocin that needed to be administered, and there was no statistical significance of fetal distress from this method of birth. And the study concludes that this practice is a lot quicker and easier, and a lot of mothers reported a higher satisfaction rate when compared to the control group of women giving birth on their backs. Some potential limitations I found in a Healthline article. This article was written to kind of be more of a guide for mothers rather than a scientific study. But some of the things that were mentioned is that not all hospitals will allow this method of birth, just depending on the procedures and protocols of the different hospitals. But it did also mention that not all mothers will be able to utilize that, just depending on their supervision needs, as well as their ability to access some of those objects like a birthing chair. For improvements of this practice and tradition, I do feel that this should be utilized a lot more just because of the study that I found. And in my experience, I've seen a lot of women bond over childbirth due to how drastic and painful of an experience it can be. Another Library of Medicine article that I found looks into whether a gravity birth can reduce the need for an epidural and concluded that it does lower the need for one. And another article by GoodRx describes how an epidural can cost $1,000 to $8,000, which will result in a very large copay depending on the type of insurance or if there's insurance at all. So therefore, a less painful birth could mean it's easier for mothers to endure, making it easier to go through that process, but also to bond with their child. and could mean it'll be easier for them to afford in the long run. I feel that this should be the default means of women giving birth.